स्टार्ट करना पड़ेगा फिर मैं बोलूंगी ना।
यही होता है।
और ये लिंक मुझे भेजा होता तो मैं व्हाट्सएप किया तो मैं मेरे लोगों को भी बोलूंगी ना।
मोबाइल से भी वो लिंक ग्रुप में देने से
है क्या ग्रुप में है कि नहीं?
ग्रुप में
है ना?
ग्रुप में वो डायरेक्ट
वो लिंक खुलता है, ये
कौन
जैसे
सा?
है ना, डॉक्टर आलोक ने भेजा है,
हाँ
इसको ऐसे खोलेंगे।
हेलो हेलो
ट्रांसफर सर।
नमस्कार नमस्कार विनोद, कैसा है?
बस ठीक है सर, आशीर्वाद है।
हेलो। हाँ
बोला बोला किसी ने बोला है।
नमस्कार मैडम।
सर नमस्कार,
नमस्कार मैडम।
कैसे हैं सर?
अच्छा है मैडम, बढ़िया है मैडम।
नाइस टू सी यू ऑल।
थैंक यू।
बहुत ज्यादा ब्राइट।
नहीं सर, मैनेज कर रहे हैं सर।
अभी आ रहा कुछ?
अभी आ रहा है क्या मेरा आवाज?
Yes, yes, we can hear you, Junita.
Yes,
Please
ma'am.
start.
Okay.
Okay, let's start. Yes.
Okay. Hello everyone. Good afternoon. I, Dr. Junita Swear, lecturer in Shilya Tantra Department, welcomes you all on today's program of one-day workshop on the theme Ancient and Advanced Modalities for the Management of Piles on the occasion of World Piles Day, that is the 20th November of this year. And here also in India, we already started the awareness campaign for piles from 21st of this month for the whole week. And now I welcome our respected director, Madam Dr. Nita Mehesekar, Nia Shillong. I also welcome our respected speaker, Dr. P. Hemant Kumar Sir, HOD Department of Shilya Tantra, NIA Jaipur. I also welcome our respected Dr. Pankaj Burman Sir, HOD Shilya Tantra Department of Guwahati Ayurvedic Medical College, Guwahati. So now I would like to request Dr. Nita ma'am, our director madam, for the welcome speech. What do you ma'am?
Namaskar, good afternoon to everyone on this board today. We are really pleased to have you all, sir. It will be a conglomeration between East and West. So I welcome again Dr. Hemant Kumar sir and Dr. Burman sir. So we would definitely will be going out through a good manthan of East and West sir. तो मैं सभी को congratulate करना चाहूंगी. My own team from NIA and the rest who are on this platform. So today, definitely we got to know that advances made in surgery are more into the ancient science of Ayurveda, which is still sustaining. And we all know the anecdotes कि जो piles है आरीवत जैसे तकलीफ भी देता है उसी प्रकार से we have an anecdote with general stories linked up when Nalanda was at its height, Takshila was at its height, and Chanakya, the guru over there, when he was defeated. I would like to share this story definitely because Nanda had humiliated him, and once he was pouring down buttermilk onto the grass. We know the grass goes on recurring again, growing again and again, and it cannot be rooted out. So he was pouring buttermilk, and then somebody asked him, why are you pouring this buttermilk on the grass? So, and it will not be removed easily. But he said, as this grass grows, the recurrence is there, but समूल नष्ट जहां करना है तो वहां पर छाछ ही डालना है. तो छाछ जब इतने ऑब्स्टिनेट ग्रास को खत्म कर सकता है, तब वही पथ्य चरक संहिता में हमारे पास अमृत तुल्य अग्निदीपम अनुलोमन, जो कि इस अर्श को भी समाप्त कर सकता है. So we have this anecdote in form of the stories where a professor of economics, जहां पर कौटिल्य शास्त्र लिखा चाणक्य ने, उनको इसका भी ज्ञान था. तो इसी से हमारा विस्तारित आयुर्वेद का ज्ञान प्रदर्शित होता है. And the stalwarts today, like Hemant ji and Burman ji, will definitely enlighten you all on these aspects of advanced technology, what we are adopting today in the form of not only surgeries. We have another weapon with us, which is XAR. And this is how we all can get to enlighten with your knowledge. So I congratulate everyone and thank you for giving this opportunity by the whole team of NIA. Thank you so much.
Thank you, ma'am, for the warm welcome speech. Thank you so much. And now I would like to introduce our first speaker of today's occasion, Dr. P. Hemant Kumar sir. He is the professor and HOD of Shalya Tantra Department, NIA Jaipur, and also the Dean of PG Studies, NIA Jaipur. Sir has achieved his BMS degree in the year 1992 from NTR University, Andhra Pradesh, completed MS in Shalya Tantra in 1997 from BHU Banaras, PhD in Shalya Tantra from NIA in 2010 Jaipur, and also completed his diploma in yoga from BHU, and around 25 years of his experiences in the field of Ayurveda. As an Ayurvedic surgeon, he has achieved his expert in the field of surgery from SDM College of Ayurveda, Hassan, and later appointed as professor and HOD in Department of Shalya Tantra, NIA Jaipur from 2014 till date. He has also delivered many speeches from national and also international, published various research articles and books like Recent Advances in the Management of Hemorrhoids and many more, has achieved many awards, and one of the famous awards, Acharya Award in 2017 from CCIM Ayush Ministry, and also Shushruta Ratna Award in 2009. And have expert in many creative fields also. So hereby I request respected P. Hemant Kumar sir to deliver us a speech of today's occasion. Over to you, sir.
Thank you, madam. screen is sharing, my screen.
Yes, sir.
Now it is clear. Slide.
Yes, sir.
Yes, sir. Yes, sir. It's clear.
Okay, okay. Yes, yes. Okay. Namaskar. Om Dhanvantaraya Namaha. Om Manjunadaya Namaha. Respected Dr. Nita Madam, Director of National Institute from Shillong, and the team of Dr. Alok Kumar from Shailatantra Department from Northern Eastern Institute of Ayurveda and Homeopathy, and all other Ayurveda fraternity, PG scholars, PhD scholars from various places in India and abroad. And today we are going to discuss about the Ayurvedic modalities of treatment in Arshas on the occasion of World Piles Day. I welcome you to today's program. See, this is our institution, National Institute of Ayurveda, autonomous institution from Ministry of Ayush, and it is recently our institution is completed 2 years, deemed to be university, and our hospital is NABH accredited and NAC accredited. See, before starting presentation, see, these are services available in the Department of Shailatantra in NIA Jaipur. And we have a general surgery unit, anorectal unit, orthopedic and marma chikitsa unit, cancer OPD, anusastra unit, endoscopic unit. And this is our anorectal OPD. And this is general surgery unit. And we have a separate OPD and unit for orthopedic and marma chikitsa unit. And we are treating all musculoskeletal disorders and internal fixation and external reductions, open and close reductions.
सर पीपीटी शो नहीं हो रही सर.
No, PPT is clear.
नहीं सर ब्लैक आ रहा है सर.
Abhi? Now okay?
No, sir. No, sir.
No.
Now it is black, huh?
Yes, sir.
Yes, sir.
Yes, sir. It is black.
Okay, 1 minute. I will go for again. I will go for again sharing. Start now. Now okay?
Yes.
Yes, sir. Yes, sir.
Okay. Any problem? Please kindly inform.
Yeah.
So this is our orthopedic and marma chikitsa unit. And we started 4 years, almost 5 years back, endoscopic unit. We are performing all gastroscopic and colonoscopic diagnostic procedures. And IPD. And we have a well-equipped operation theater. We have all facilities like C-arm and anesthesia working station and recording facilities for documentation. And another beauty of our department is hand-to-hand surgical training. See, we will practice what by our PG and PhD scholars trained by our teachers by hands-on training. Then, problem. Now, okay, slides.
Yes, sir.
Okay. And all major surgeries we are performing, like appendectomy, gallbladder surgeries, urinary calculus, and tumors, hernia, gangrene, etc. And all orthopedic procedures like screws, plates, open reduction, close reduction, fixation, tendon repair, amputations, and reconstructive surgeries like reconstruction of the nose, oroplasty, skin grafting, etc. And all anorectal procedures we are practicing like fistulectomy, polypectomy, hemorrhoidectomy, IND, other anorectal procedures. And minor surgical procedures. And Marma Chikitsa, we are practicing from 2015. We have a separate OPD for treating musculoskeletal disorders like a frozen shoulder, low back ache, and tennis elbow, cervical spondylosis, etc. And bloodletting procedures by Jaluka Ucharna, Srungavacharna, Prachana, Siravedan, and Agnikarma procedures to relieve the pain in frozen shoulder, osteoarthritis, calcaneum spur, and Kshara Sutra, Kshara Karma, especially there is a lot of contribution in our institution, application of Pratisarnya Tikshna Kshara in various anorectal diseases. And recently we started laparoscopic surgeries in NIA. And this is the case of lap cholecystectomy. And we started laser surgeries in anorectal diseases. And we are using various diagnostic tools like video rectoscope, fistuloscope. And we have a simulation lab, Yogya Karmakara, for training of our PG and UG scholars on simulation-based education in dummies. This is very interesting multi-purpose anesthesia training tool. It is just like a human body. We can create the conditions like cardiac arrest, and you can go for CPR, and you can go for defibrillator, etc. by this mankind. And we will train for mock drills to the emergency surgery, like primary emergency care to our UG and PG scholars. And within short, we are getting this laparoscopic simulator and gastrocolonoconic bronchoscopic simulator. We will train for our PG scholars on hands-on eye coordination by the simulators. And within short, it is under construction. First modular operation theater with all facilities we are going to construct in our NIA. And these are the major operation theater statics from 2009 to 2020. The gradual major surgeries increasing gradually. And this is a symbol of proctology. I created this symbol. Why? Because finger is very important. Anguli evam pradhana yantram gudavikare. Without finger examination, we can't diagnose so many anorectal diseases. By finger examination itself, we can diagnose polyps, tumors, ulcers, and especially identification of the internal opening of the fistulous tract. We can easily identify with the finger. And see, our Google also accepted finger is very important for diagnostic aspect. Then coming to topic, today the topic according to is arches or hemorrhoids. It affects anyone, anytime, any place and anywhere. It is the commonest disease occurs in anorectal region. And recent statistics reveals the irrespective of age, sex, socioeconomic status, people suffer from piles. Nowadays, because of life changing of the lifestyle, and almost every person suffering from any complaint of piles during their lifetime. See, this is a very great contribution of Susruta, father of surgery in 500 BC. The first person given a separate chapter for ushers and their management in his treatise Susu Samhita. Arivat Pranan Srunati Arshaha. Arshas is the fleshy projections that create obstruction in anal canal. It kills the life like an enemy. See, there are different types of arshas, and number one is Vataja arshas. Usually, all arshas are not hemorrhoids, but all hemorrhoids are compulsory arshas, and especially correlating with the hemorrhoids, the Pittaja and Raktaja arshas considered internal hemorrhoids, and Vataja and Kafaja arshas considered as a external hemorrhoids. See, Vataja arshas looks like a dry, hard, painful, different shapes. It looks like a sentinel pile or external piles, hypertrophied anal papilla, anal warts, or any condyloma, acuminata, and painful conditions. Pittaja arshas is a real hemorrhoids. We can see that is the bleeding piles or internal hemorrhoids. We can say a small bluish, moist, fleshy mass of different shapes enlarges during straining with the passage of blood mixed stools and burning sensation during defecation. See, they're given as a faintness, thirst, and shock. See, why? Because faintness, thirst, and shock, it looks like a anemic feature. We can see the continuous bleeding. And please unmute. Please mute itself, please. And Kafaja arshas. It is a broad-based, smooth, fixed oval, fleshy masses and does not separate severe pruritus. You can compare it with fibrosed piles or external piles. And Raktaja arshas, it is a typical bleeding hemorrhoids. That's why there are two types of arshas gradually by divided Sushka arshas and Ardra arshas. Sushka arshas is Vata Kafaja arshas, Ardra arshas is Raktaja and Pittaja arshas. That means Sushka arshas considered as a external hemorrhoids and Ardra arshas considered as a internal hemorrhoids. See, there is another type mentioned by Susruta, Sahaja arshas. You see, it is a genetically determined fleshy masses with immunocompromised symptoms. We can see nowadays rectal polyps or familial adenomatous polyps are considered as a Sahaja arshas. And Tridosha arshas, actually Tridosha arshas is not considered as a hemorrhoids. Why? Because it is a mixing of all the features. You can go through detailed description of Tridosha arshas. It looks like a malignant growth. Maybe CA cola, CA anal canal, or malignant melanoma, or CA rectum. See, coming to classification of the piles according to present contrast, internal piles, external piles, and both internal and external, it is considered as interior external piles. So according to anatomy, pathological anatomy, primary piles and secondary piles. Why? Because if it is 3 o'clock, 7 o'clock and 11 o'clock position, that is primary piles. Other than 3, 7, 11, it is considered as a secondary piles. And be cautious about secondary piles to rule out any secondary pathology. Maybe ulcerative colitis, maybe Crohn's disease, or maybe CA of colon, or maybe some portal hypertension, cirrhosis of liver. You must have to rule out by the secondary piles. See, according to prolapse, there are first degree, second degree, third degree, fourth degree, or may consider as a first stage, second stage, or first grade, second grade, third grade, and fourth grade. according to the prolapse of the internal piles, there are 4 degrees. In first degree, there is a no prolapse. Only patient complaint to you, just bleeding per rectum, there is no mass. That is called as a splash in the palm. And second degree, there is a bleeding is there. And during defecation, the mass coming outside and reduced spontaneously after defecation. You see, this is very important. Second degree, both bleeding is there and also spontaneously reduction after defecation with mass. Third degree, hemorrhoids coming out only during defecation and do not return by themselves, but requires manual reduction. It needs only manual reduction to reduce the pile mass to push inside the anal canal. And fourth degree, it is a permanently prolapsed and proper replacement is not possible. Okay. There are 4 degrees of hemorrhoid: first degree, second degree, third degree, and fourth degree. Then coming to symptomatology like bleeding, prolapse, pain, especially pain you can see in thrombosis, or you can see in perineal hematomas, or maybe in gangrenous necrosed piles. In that condition, there is a pain is there, and mucus discharge, pruritus ani, and anemia. And maximum patients coming to hospital features looks like anemia, and they ask about compulsory any history of bleeding per rectum. Then coming to the treatment modalities of arches or hemorrhoids. Acharya Susruta mentioned in Chikitsastan, Chaturvida Arshasam Sadhanopayaha Tadyada Beshajam Shara Agni Sastramiti. That means Beshaja is a medical management, Kshara, it is a caustic therapy, Agni, it is a thermal therapy, and Sastra, that is a surgery. There are 4 modalities mentioned by Susruta. See, before going to treatment, you must do proper selection of the patient is very important. Which modalities is suitable for which type of patient? That's why you can go for proper history of patient, systemic examination, local examination by inspection or palpation, digital examination, and properly commonest simple instrument, that is by proctoscopy. It is sufficient for diagnosis for hemorrhoids. Sometimes you want to rule out any secondary pathology, you can go for either sigmoidoscopy or colonoscopy. Then investigations also very needed before going to either parasurgical procedures like Charakarma, Charasutra, Agni Karma, and leech therapy, or maybe Sastra Karma. You must to go for investigations, routine blood and urine investigations, or sometimes you have suspect any growth is there, any polyp is there, and you can go for biopsy and chest X-ray, barium minima, etc. Then first line of management is medical management. See, almost the coming to our hospital, more than 50% of the patients, you see, by medical management, it dissolves the hemorrhoids and reduce the symptoms of the hemorrhoids, especially in the first and second degree hemorrhoids. But in third degree and fourth degree definitely need some parasurgical or surgical intervention. See, what is the important indication of medical management? Achirakala jata anya alpadosha, alpalinga, alpa upadravani, veshaj sadhyani. Clearly, it is a recent origin and a recent history, minimal doshas involved, minimal symptoms, and minimal complications. Then you can go for our medical management. See, in medical management, Susruta mentioned local measures like Abhyanga, Vasti, and Avagaha. Abhyanga, especially they give an oil process, Vichitraka, Yavakshara, Bilva, And especially this preparation is useful for Vata Kapha arshas in external hemorrhoids. And Vasti, eliminating the pain and itching. Definitely, if there is a thrombosed pile masses, inflamed pile masses, or any painful condition of the piles, you can go for Matravasti, like Chitrakadi Taila, Ishtimadi Taila, Mahanarana Taila, Matravasti is advisable. And Avagahasveda, Sijpath, you see, till today, almost maybe Ayurveda or maybe modern counterpart, they are practicing Sijpath. See, in Sijpath, we can use with any type of kashayas like Trifalakwada, Bilvakwada, Badirakwada, or Tankanabasma. You can go for Sijpath for all parasurgical or surgical post-operative condition, or to reduce the pain and inflammation for hemorrhoids, you can go for Sijpath. Then these are the different various medical preparations available. I'm giving some of the examples like Churnas, Ayupatikar Churna, Chandanadi Churna, Panchashama Churna, Patola Muladi Churna.
Slide.
Okay, slide is not visible. Hello, slide is not visible.
Slide is not moving, sir.
Not moving, huh?
Yeah.
Okay, 1 minute. I think in between some calls are coming, huh? That's why there is some problem. Nothing. I'll go for again. I can go for again. No slides are visible?
Yes, sir. Now visible, sir.
Yes, yes. Thank you. Thank you. Okay, these are churnas and especially tablets like Kankainavati, Yoshadavati, Suranavati, Trifala Gugullu, Nimbadi Gugullu.
Yes, sir. Now visible, sir.
Okay, okay. And aristas commonly are practicing Abhyarista, Dashamula Arista, Takra Arista, etc. And Rasaushadhas like Arshakuta Rasa, Bolabhadra Rasa, and especially Bolabhadra Rasa is very important for reducing of the bleeding, Raktastambhaka. And Purannavadi Mandura we can give for, especially for anemic patients and chronic bleeding per rectum history, you can go for Purannavadi Mandura. And Changeri Gruta, Dadimadi Gruta, Sukumara Gruta, we can go by internally or by external application. And Tailas, Kasisa Taila, Mahanaran Taila, Estimudi Taila, we can apply the internal hemorrhoids or you can use with Vasti also. Then coming to Charakarma, that is caustic therapy. And almost more than 25 years I am practicing Charakarma in various parameters and various drugs we have taken. And it is the minimal invasive Ayurvedic parasurgical procedures. Chara is a caustic chemical obtained from ashes of medicinal plants. It acts as a Chedana, Vedana, and Lekana karma. Why? Because without this Chedana, Vedana, Lekana karma needed with the help of instruments, it is Anusastra. Without help of the instrument, we can achieve the Chedan, Vedan, Lekan with Kshara karma. And who are afraid of surgery? So many times the patient is not interested for Kshara Sutra or not interested for any type of procedures like surgical procedures, etc. Then you can go for Kshara karma. See, this is the preparation by Kshara karma. We are using 3 important drugs like Apamarga, Shukti,
Sir, it's
Chitraka.
not visible, sir.
Okay, okay. One minute. Now, okay?
Yes, sir. It's visible
Okay.
now.
You see, Susruta mentioned kshara into 3 types: Mudhu kshara, Madhyama kshara, and Tikshna kshara. Mrudu I have taken as apamarga. See, in place of apamarga, we conducted so many research works like Patala, like Snuhi, like Chitraka, or like Udambara, like Aragvada. So more than 28 drugs mentioned by Susruta. Out of that, we can take any one drug as a Murdukshara. Madhyama, you can take a Shukti or Shanka. And Tikshna Kshara, we can take as a Chitraka or maybe Ativisha, Langali, etc. The pH of prepared Pratisarni Tikshna Kshar is around 13.8. See, then what are the indications of Kshar? See how the beautifully mentioned by Susuta, they given indications according to modality. See, nowadays you can go for recent trends of modalities like sclerotherapy or rubber band ligation or laser therapy or maybe radio frequency coagulation, cryosurgery, surgery. There is a different indications they given, not for all piles need the same management. Different indications are there. Here also Susruta mentioned about indication of Kshar is Murdu Prasruta Avagada Uchitani Ksharena. Especially we can go for Murdu Prasruta Avagada Uchitani Ksharena. That means especially internal hemorrhoids like Pittaja and Raktajarshas, we can go for Pratisarnya Tikshna Kshar. So this is the application of Kshar by Susruta performing Kshara Karma in nurses. You see the beautiful picture designed in BHU in Charasutra Resource Center. You see, patient is in lithotomy position, and Susruta they mentioned about lithotomy position, and patient face is east facing, and surgeon is south facing, west facing. One side there is a sun is there. You can see this is one type of usually surgeries they perform in Susruta's period in early morning. See, sun it itself as a works like a direct light, and with attendants and assistants, and with all you can see the Agni Karma and for sterilization of the instruments, everything it is there. It is a beautiful concept of designing of operation theatre by Susruta. And application of Kshar, any application of Kshar or maybe any other procedures, the required instruments are important like proctoscope or Kshar, lemon juice, tissue forceps, artery forceps, etc. If it is a patient is admitted 1 day before, you can go for nil orally. And early morning, you can give a mild enema, or you can go for the proctoclus enema. Or if not given enema, also no problem. 1 day before, you can give proper laxatives and pass 1 or 2 times next day morning. Then you can go for tetanus toxide, etc. And these are the instruments you can see. Like Ekachidra Yantra and Dichidra Yantra and lemon juice, Kshar, etc. We can before application. And my slides are clear? Hello?
Yes, sir.
Okay, okay.
Yes, sir.
Then the procedure of Kshara Karma in hemorrhoids, you see, patient is in lithotomy position, either go for LA, local anesthesia and spinal anesthesia, but I preferred maximum cases under local anesthesia only. Then clean with aseptic solutions. Introduce Arshoyantra or proctoscope to assess the pile mass. Then you can go for Lekana Karma with pile mass. If it is a bleeding piles, don't go for rubbing. If it is a non-bleeding pulse, you can go for rub. Or without scrapping also, without Lekana Karma also, you can apply the Kshar. Then you can apply Kshar on internal piles. Then wait for Satamatra Kala, counting 1 or 2, 3, 4, 5, up to 30 seconds, up to 1 to 2 minutes, you can wait for that. Then you can go getting Pakpa Jambu Palavarna. It is a reddish black in color. Then pile mass washed with lemon juice And why? Because Kshara is alkali and lemon juice is a acidic, citric acid. To neutralize Kshar, Dagda by Nimbuswaras, or maybe what is called as a Takra, Kanji, etc. also we can apply to reduce the Dagda Varna. Then finally apply Yashtimada Gruta and remove the Arshoyantra and pack with any Grut like Jatyadi Gruta, Yashtimada Gruta, Mahanaranthal, etc. Then post-operatively, if it is a spinal anesthesia, we can go for nil up to 4 hours. If it is a local anesthesia, within half an hour to 1 hour, you can start a liquid diet. And pack removed after 6 hours, and you can go for Sijubath with Trifalakwada, Tankanabasm, etc. 2 or twice daily. And usually post-operatively, we give Trifalagugulu or Gandhakarasign and Shatsakara Churna or any laxatives like Isabgol, etc. We can go for laxatives. And very important in Kshara application, post-operatively, you can go for at least minimum 15 days to, that means 2 to 3 weeks, you can go for Yashtimadu Taila Matra Basti. 10 to 15 ml, you can give 3 months Yashtimadu Taila Matra Basti to reduce the Kshara Dagda and encourage the healing of the wound. See, these are some of the cases. I'll show it. You see, this is the case. You can see bleeding piles before and during, after application of Kshar. You can see the achieving of the Jimbu Palavarna. Then this is another case. The second degree internal hemorrhoids. After application, we can achieve the Jimbu Palavarna. See, this is another third degree internal hemorrhoids before application, during application of the Kshar, and after application. You can see the achieving of the Jimbu Palavarna. See, this is after complete healing. After 3 weeks, you can see the completely healed scar. And this is the colonoscopic appearance of Kshar in hemorrhoids before, during, and after application of Kshar. And how it acts. So this is very important mechanism of action. It coagulates protein in hemorrhoidal plexus, disintegration of hemoglobin, heme plus globin. That's why after 24 hours application of Kshar, then there is a blackish brown discharge. You must have to inform to the patient. 5 to 6 days, there is a blackish brown discharge occurs after defecation every time. Okay, that indicates your Kshara is working nicely. Then it cauterizes, it reduces the size of the pile mass, and it goes to necrosis of the slough out and gradually obliteration of the hemorrhoidal vein, and complete wound healing takes up to 21 days. See, we conducted a study of histopathological study for sloughing collected after Charakarma. After sloughing, we can take the sample and send for histopathological study. We can get a necrosed hemorrhoidal tissue that it indicates your Pratisani Tikshakshana applying on the pile seat, reducing the hemorrhoidal tissue or sloughing of the hemorrhoidal tissue. And these are the advantages, like it is a simple procedure, mild post-operative pain, no bleeding, minimal hospitalization, no stricture formation if the correct procedure is followed, and cost effective, and treat all the piles in single sitting and reduce the total duration of the treatment. See, then coming to, there are some complications we have seen in Pratisarni Tikshakshara also. Sometimes there is a bleeding, sometimes patient complaint of pain, post-operative burning pain, post-operative edema, sometimes stricture formation if you are not properly applied. Why? Because you can apply only 3, 7, 11 o'clock, other rectal mucosa covered with the swab. And there is a recurrence if your preparation is not good or not properly applied, there is a chances of recurrence. Then coming to Kshara Sutra in Arshas. See, some Ayurvedic surgeons, they are practicing Kshara Sutra in Arshas. The indications you can go for, especially we can go for internal and external hemorrhoids, you can go for Kshara Sutra application. Or third degree, fourth degree, you can go for Kshara Sutra application. First degree, second degree is very difficult. Okay. These are the drugs, the normal Apamarga Kshara Sutra like Apamarga, Snuhi and Haridra. Normal Kshara Sutra, what we are using in fistula in ano, and you can use in hemorrhoids. See, application of the Kshara Sutra, same. What preoperative measures mentioned in Kshara Karma, you can follow same as it is. And the procedure, these are the instruments you can see, slit proctoscope and normal proctoscope with the Kshara Sutra, etc. And Pradhana Karma, you can see in patient is in lithotomy position and clean with aseptic solutions and local anesthesia. And if it is an interior external pile mass, you can cue small cut at mucocutaneous junction and hold with the pile holding forceps and ligate the pile mass or transfix the pile mass at the base and ligate it properly and replace inside the rectum. Then pack with Eshtimudutula. Up to 1 week, it gradually going to necrosis and blackish discoloration, and gradually within 1 week, it going to slough out. And these are the cases you can see holding of the pile mass with the pile holding forceps and ligating with Kshara Sutra or the pedicle of the pile mass. And this is the during application of Kshara Sutra. And after 1 week, you can see the completely there is a necrosis and fallout. And post-operative care, as it is very important, but don't effort to pull out the Kshara Sutra and the piles may cause of bleeding and pain. And remaining the, you can go for Sijibatu, Trifla, Gugulu, Gandhakresan, etc. You can go for that. Some of the complications you can see by Kshara Sutra also, there is a severe pain, retention of urine because of pain, reactionary edema, severe bleeding, secondary infection. Sometimes there is a prolapse of the rectum if you apply to all the 3 pile masses. See, then coming to another modality of management after Kshara Sutra. That is Agni Karma. Susita also mentioned there is a modalities in Agni Karma. See, Agni Karma is also one of the important parasurgical procedures. And the main indication of Agni Karma is Karkasha, Sthira, Prudu, Katina, and Agnana. See, rough, fixed, broad, and hard type of piles. That it indicates Agni Karma is indicated in Shushkarses. External hemorrhoids, we can see that. And Agni Karma procedures, we can go for to collect Grutakumari, Trifla Koadu, thermal cautery. We can use with, nowadays we are using thermal cautery mission. And all other preoperative measures following like a Kshara Karma. And here patient is under local anesthesia and external piles grasped with Alice tissue forceps and cautery used for mucocutaneous junction and the external piles for excision. And the Dagdavarana you can clean with either Madhu or Grutakumari Swaras. You see, this is the external hemorrhoids before, during, and excision of the external hemorrhoids with cautery by Agni Karma. This is the post-operative wound. And post-operative care as like a Kshara Sutra and Kshara Karma. Then this is the mechanism of action like excision and scrapping action, hemostatic action, and Vata Kapha hemostatic action, and Vata Kapha Doshahara, and especially it, Chedana effect is there. My slides are moving?
Yes, sir.
Okay. See, nowadays you can see whatever that is using of energy system, it comes under Agni karma.
Yes, sir.
You see nowadays the using of laser hemorrhoidopexy, bipolar dithermy, or radio frequency ablation, or infrared coagulation is nothing passing of the heat energy by different equipments and different machineries, but the concept is similar. What Susruta has mentioned in the practice of Agni karma in Arshas, maybe monopolar, bipolar, or laser, or etc. comes under Agni karma. Then Rakta Mokshana, some places Susruta mentioned, not in the chapter of Arshas, they mentioned one place he mentioned about contraindication for Rakta Mokshana. In another place he mentioned protruded pile masses, you can go for Rakta Moksha. And Vagbata and Charak also they given the reference for leech therapy in inflamed hemorrhoids. See, this is the application of Jaluka, what we are applying leech therapy in wounds. Same thing when applied, especially thrombosed external internal prolapsed piles, we can apply for the Jaluka Charana. Same, you can prick a small prick at the pile mass and with sterile needle and get the drop of blood from the pile and apply the mouth of Jaluka near the pricked point and expands its mouth and sticks to the point. And wet gauze is covered over the Jaluka during sucking of impure blood in Arshas. If the Jaluka sucking of pure blood complain to the pain and itching over the set, then you can remove the Jaluka. And these are some of the cases of thrombosed piles before and during after application of leech therapy in inflamed or thrombosed hemorrhoids. This is another case of leech therapy before, during, and after. You see here what happened, reducing of the inflammation. See, especially for thrombosed or inflamed hemorrhoids, there is no treatment, either medical management or simply wait and watch. In that condition, we can go for reducing of the inflammation without any painkillers, without any antibiotic. We can use with the leech therapy to reduce the inflammation. After that, you can plan for either Sastra Karma or Kshara Karma or Kshara Sutra. This is the perineal hematoma, you can see, leech therapy. And post-operative, you can use the Satatota Gruta or Madhu. You can use. And this is the main mechanism of action is anticoagulant effect and local anesthetic effect. Then another modality is called Sastra Karma, surgery. See, every time we are asking about the question, hemorrhoidectomy is there, or maybe another surgical procedure is there in Ayurveda or not. Susruta, they clearly mentioned excision after transfixation. It's clearly mentioned in Tanu Mula Anya Urchitani Kledavanticha Sastrena. That is a pedunculated and bleeding type of arches. We can say either 3rd degree internal hemorrhoids or 4th degree internal hemorrhoids or interior external hemorrhoids. We can go for Sastra Karma. Here we can give the pile mass excised by incising with sharp instruments such as Karapatra. See, here also Susruta mentioned after transfixation, excision with the help of blade or with the help of scissor, or we can with the help of the Agni Karma, they mentioned, excised part. See, nowadays also we are ligating of the hemorrhoid plexus and excise with the cautery. See, nowadays what the ligation excision is the present day of practice. You see, if you go for in old techniques, you see, there is a Gans clamp and cautery method in 1910. They mentioned about clamp and cautery method. Later, the development of Kushak, they mentioned about hemorrhoidectomy with clamp and cautery method. See, in hemorrhoidectomy, they will go for, in place of transfixion, they will go for clamp and cautery, excision. This already reference given by Susruta, and nowadays we are using for vasosealer. We can use excision of the hemorrhoids. So this is the case of Sastra Karma, excision, followed by the Agni karma of prolapsed hemorrhoids. So this is another case of hemorrhoidectomy. See, nowadays different types of hemorrhoidectomy. The concept is similar. Transfixation, excision. Chedana karma is the concept is similar. Nowadays, so many advancement technologies are there, coming and going. Stippled hemorrhoidectomy. Previously, nowadays, not that much popularized. Now you can see stippled hemorrhoidectomy, that is MIPH procedure, almost the banned in USA and UK. See, but still Chedana karma is persist. Still hemorrhoidectomy is persist. And these are the technologies coming. And for sometimes, and new another technologies are coming and going to replacing the old technologies to the new technology. But the procedure is similar. See, these are the 4 modalities mentioned by the Susruta, like Kshara karma, Agni karma, Sastra karma, Beshaj Chikitsa, and along with Kshara Sutra and Rakta Moksha also mentioned by Susruta. And according to your indication, then you can practice any modality of management for success of the treatment. See, there is another beauty of Ayurveda. Without Patya and Apatya, disease is not completed. You must to advise the patient Patya and Apatya. Why? Because there is a chances of recurrence. To avoid that, you can go for like Goduma, Yava, Shali, Kulutta, Patola, Vartaka, Shigru, Balamuli, Ajakshira, Takra, Marich, Nagara, Palandu, Amlaki, so many other food habits they advised for ushers during treatment and after treatment. And you must to avoid Guru Ahara, Anupa Mamsa, and Vega Avaroda. You see, it is very important, Vega Avaroda. This is the very important causative factor, straining of the stools, continuously sitting in the toilets. See, in olden days, what happened? They're reading the newspapers. Now, what happened? The technology developed. They're now using the mobiles in the toilets, using WhatsApp and etc., and increasing the time of defecation and continuously straining and change of lifestyle. And there is a common indication, common problem is hemorrhoids. See, another is Utkutasana. See, this is also very important, sitting in continuously sitting, working, or continuing awkward position. Prushtayana. See, Prushtayana is riding. We are getting more anorectal cases with drivers. And Ati Sri Sangha. Again the question, Ati Vivaya, Ati Sri Sangha. You see, the history of Bimbisara, the son of Ashoka, the history, he suffered with anorectal problem with Atisri Sangha. More than 300 wives are there. There is a history is there. Until if we give more perineal exercises, there is a chances of straining hemorrhoids or maybe abscess, etc. Then these are the various publications. Slides are moving. Hello?
Okay, sir. Slide.
Okay, slides are moving. Okay. These are various publications. This is very important. Whatever your research, the publications are very essential. You must to properly document, and more than 40 publications related to Kshara Karma and other modalities in various journals. These are various publications by different treatments. So this is the various publications with comparating with Apamarga with some other like sclerotherapy, laser, etc. And 2 books published. It is available in Chokamba. And these are the various research works worked on Kshar. So different Ksharas like Arka Kshara, Aragvada Dikshara, and Patala Kshara, and sclerotherapy with Apamarga Kshar, and Murdu Madhyama and Tikshna Kshar identification, Nimbakshara, Apamarga with low anal fistula, like Snuhi Pratisarni Kshara, like different Ksharas we conducted research works. And I say that all the treatment modalities of Harshas or hemorrhoids are Indian contribution to the old science. Till today, we are practicing successfully, and we getting a good number of patients for almost all Ayurvedic Shalyatantra OPDs in India. And I am very thankful to organizers, especially Madam Director, Madam and Dr. Alok Kumar and team for giving an opportunity to share my knowledge in Northeastern Institute of Ayurveda and Homeopathy from Shillong. Thank you. Thank you one. All. Any queries you can go for.
Thank you, sir. Thank you so much. Thank you so much, sir, for the information and the informative slides and wonderful presentation, sir. Thank you so much. And now I would like to request our second speaker, Dr. Pankaj Burman, sir, of today's occasion. He is the HOD and professor of the Shilya department from Guwahati Ayurvedic Medical College. And he has passed his BMS in 1997 from Guwahati University, MS in Shilya from BHU in 2002, PhD in Shilya from Srimanta Sankardeva University of Health Sciences, Guwahati in 2021, and around 90 years of experiences in the field of Ayurveda as an Ayurvedic surgeon, has published 25 national and 15 international journals. He also presented as a resource person and achieved an award called Shushruta Ratna Award in 2017 from National Shushruta Association, India. Now I would like to request Dr. Pankaj Burman, sir, to deliver us a speech. Over to you, sir.
Sir, your voice is not very much clear. But yeah.
hello, 1 minute.
Okay, sir. Okay.
अभी आ रहा है? Hello?
Yes, sir.
आलोक स्टार्ट कर सकते हैं ना?
Yes, sure, sir. Sure, sir.
Okay, okay. Respected Director Madam, Nia Shillong, respected Alokji and organizer of Nia. Is it audible now? Alok, is it audible now?
Yes, sir. Yes, sir. You are audible, sir.
Okay. So today I will actually I had a plan to go to NIA for workshop, but suddenly we have changed the program due to some unavoidable issues. So now I changes my lecture to in a different topic, that is diagnosis and management of hemorrhoid. So prevalence of endorectal disease is very high worldwide in either sex in all age group. Neoplastic disease prevalence is very high in Western countries, while infective disease prevalence is high in Asian countries. Due to lifestyle modification, number of benign anorectal diseases increases in India day by day. Diabetes, HIV, tuberculosis act as associated disease for different anorectal diseases in India. Most of the anorectal diseases described in Ayurvedic texts in terms of etiopathogenesis, clinical presentation, diagnosis and management, including different types of hemorrhoidal diseases, disease bleeding, which is bleeding per rectum, with different medical, parasurgical and surgical management. In modern era of surgical practice, Ayurvedic treatment for anorectal disease is becoming popular worldwide. In India, as Professor Hemant Kumar mentioned, that in most of the postgraduate institute, we offer protocol-based Ayurvedic treatment for anorectal diseases, including hemorrhoid. Government Ayurvedic College Guwahati provides standard protocol-wise treatment for all benign anorectal diseases. In the last 5 years, total number of OPD patients in our college is 1,20,000. Indoor patient is around 7,000, and operation is 6,000 from our department. So among these cases, 80% are of anorectal diseases, and most of these cases are in between fistula, hemorrhoid, and fissure nano. So it is a very popular destination for this anorectal patient, and it is a referral center from all these corporate and tertiary level care hospital. So before going to this topic, are the disease described in Ayurvedic texts: Bhagandar Pirika, Bhagandar, Ars, Parikartika, Buddha Vidradhi, Buddha Kandu, Buddha Pramsa, Buddha Sula, Raktatisar, Sanniruddha Buddha. In our allopathic medicine, modern medicine, and similar diseases are described as fistulae nano, hemorrhoid, fissure nano, perianal abscess, pruritus ani, prolapse rectum, proctalgia probex, perianal dermatitis, inflammatory bowel disease, pilonidal sinus, anal incontinence, radiation proctitis, and stricture renum. So most of this, we are in conclusion that most of these anorectal complaints are identical in ancient era and modern era of colorectal surgeries. So common complaint for anorectal diseases are in Ayurveda, this word mentioned Sotha, Brana, Nari, Bhagandara, Sula, Pandu, Buddhagata Raktasrav, Anaha, Atisara, Buddha Brahms, Kuyasrava. And in modern medicine, these are the complaints for which we think that these are anorectal cases: swelling, ulceration, sinus, fistula, pain, fever, color changes, change in bowel habit, bleeding per rectum, and discharge of pus, mucus, prolapse, etc. So most of these anorectal complaints are identical in ancient and modern era of colorectal surgical practice. So in Ayurveda, we are with the Trivit Pariksha, Darshan, Sparshan, and Prashna, and then this is the Sadvit Pariksha. You know, all these BAMS students know. Today I have actually designed this lecture for BAMS students. So in modern medicine, along with history taking, this inspection, both internal and external inspection, and palpation, both internal and external, easily practiced for treatment of Ayurvedic proctology. And already Professor Hemant Kumar described about the positions described for examination and applications of different drugs for us, where when we go in details about word by word, this is nothing but the lithotomy position used nowadays in modern medicine. So other than lithotomy, knee elbow position, maybe maybe a patient may be in knee elbow position, dorsal position, right lateral position, and left lateral position. Every position has certain advantage and disadvantage. But my opinion is that learners should always practice proctology with a examination in lithotomy position because it is anatomical. The anatomical clock is similar, and patient remain in comfortable position, and we will get excellent relaxation for procedures. Dr. Hemant already showed this. So these are the positions. What is the advantage of knee elbow position? The advantage of knee elbow position is that the posterior cleft can be easily seen, and pilonidal sinus and all these cases can be easily diagnosed. But disadvantage is it is very painful and non-anatomical. So for this procedure for longer duration, patient cannot cooperate with. Then lithotomy position is a very patient usually remain in comfort, and we get maximum relaxation for evaluation of the internal areas. But main difficulty is if some issues in the joints, then the patient may not feel comfortable, and the posterior part, this back, we cannot see it. In left lateral position, again, it has certain advantage and disadvantage, and similar thing also in for right lateral position. So from our above discussion, you can say that for a different purpose, the patient should be in the different positions. So common instrument and equipment for internal inspection of hemorrhoid. In Ayurveda, these different alloys are used for preparations of different instrument and equipments. Then Nari Jantra is a tubular instrument used for examination and procedure for any structure inside, especially their advantara ulcers. Then there is another instrument in describing cystic center. This is Arsojantra for evaluation of the internal hemorrhage and other application of Xaras. Then the different other instruments are also there. But in modern medicine, commonly we use in our center the stainless steel proctoscopes. There are different anoscopes is available. Then sigmoidoscope is also sigmoidoscope is usually done. Colonoscopy also may be used. Transrectal sonography, anal manometry. In our center for assessing the internal areas, we usually use vaginal speculum when patient is in spinal anesthesia, and other common surgical instruments also used required for this. So what are the investigations required for anorectal disease? Because we offer the services for all benign anorectal disease. This Ayurvedic treatment for all benign anorectal diseases. So that's why we have a common platform, that's a protocols for evaluation of the evaluation of the cases. So in each and every case we go for total count, DLC, hemoglobin, ESR, blood sugar, fasting BP, glycosylated hemoglobin is present in under medications, then urea creatinine. In each and every cases for surgery, we go for viral profile, we go for chest X-ray. Sometimes some issues in the system may cause issue in the perineal region. This is usually done to if there is some issues, there may be some esophageal shock, and all these issues may be there during examinations, during procedures. And if a patient is alcoholic and some other issues are there, then we usually go for liver function test because in CLD also this is associated with bleeding per rectum because dilated vein will be there. It looks like a classical hemorrhage due to CLD. So in the MRI pelvis is important because if some foci is there, neoplastic foci is there, there may be engorgement of the veins in the anal regions, USG abdomen, all these are optional investigations. And this left side is my this investigations, and right one is for these are optional. I will not go in details, but in our center, in each and every cases after surgery, we go for histopathological examination. Even sometimes it looks like a hemorrhoid, classical hemorrhoid, but after investigations, we found these are early malignancies. So, Dr. Professor Hemant already described regarding the definitions. There's in modern medicine, Ayurvedic medicines. He have already discussed already regarding different classifications in modern medicine and Ayurvedic medicines. So mostly these are identical. Uh, Etiopathogenesis of hemorrhoid. Already lots of descriptions is available in Brihatraya and Laghutraya, but when we go in details and we can club it that Viruddha Ahara and Adhasana, that means abnormal diet and regimen, Utkotasanas, defecation in abnormal positions. Lots of causes are described, out of which Mondagnini is the main cause for ours. So when we go for the treatment modalities, we have to go for correction of Mondagnini. Then Kinnodokopista Samavaya, that means alcoholic beverage, because in northeastern region you get lots of cases of hemorrhage who are with a CLD due to alcoholic beverage. So in modern medicines also these are hereditary factor, morphological factor, anatomical factor, physiological factor, chronic constipation, faulty dietary habit, sedentary habit, exciting factor and others. And some these are primaries, and some other causes are there for secondary one. These are we get hemorrhoid in the third trimester of pregnancy. If there is small hemorrhoid and with progress of pregnancy, there is this pressure increases, return fall, there may be dilatation of this hemorrhoidal plexus. Then abdominal tumor, there may be something this flow is obstructed, return is obstructed, then yesterday we have operated case, so there is a mass above the hemorrhoid. Hemorrhoid is over there, then during pregnancy it's a prolapse out. After 21 days, before 21 days, cesarean section was done, and there is a profuse bleeding and swelling. And we do the surgery yesterday, and there was a lump on the base of the hemorrhoid. So carcinoma may be one of the causes behind these cases. So obstructive uropathy now we get this elderly male person with BPH, and most of the BPH patient suffers from obstructive this different kinds of this hemorrhageal disease due to straining during exudation and portal hypertension. All the causes of portal hypertension, there may be hemorrhage. So when we design a treatment strategy, we have to consider all this. That means our one treatment strategy is not for all the cases of bleeding per rectum. That's why Sushita nicely described different classifications as well as different modalities of treatment. So in Ayurveda, we can club it that different nidana mentioned above, dilatation of the vitiation of dosas, involvement of tasa, rakta, meda, mamshadhara colors, formation of mamsam chorus in the gudas, formation of arsas, which may bleed, may not bleed, may be complicated, may be uncomplicated. In modern medicine also, similar concept we found. So already Professor Hemant described details about Vata Jarsa, Pitta Jarsa, Kapha Jarsa, Rakta Jarsa, Sannipata Jarsa, and Sahaja Jarsa. So when that's my opinion is that whatever the character described for Vata Jarsas, these are nothing but when you go into this bleeding with pain, there is a tag, there is a lining. So these are nothing but fissure with a big sentinel tag. And a pitta is bleeding due to fissure associated with hemorrhage and this tag. A pitta one, when you go in details about the color, consistency, characters, these are nothing but bleeding hemorrhage. Kapha one, these are nothing but prolapse, thrombosed hemorrhage. Rakta are nothing but when we go for the bleeding character of bleeding, the mass, size, these are nothing but early anorectal malignancies. Sannipata one is nothing but advanced anorectal malignancy, which is inflammation and ulceration. That's why there is pain and all these things will be there. And Swaja, Bija, Dasaptha, that means these are hereditary disease. And most of the hereditary polyposis color character is similar with the Swaja also, including the visible vein, alpayud. It's all this character when you go, these are nothing but hereditary polyposis color. So I think now I have designed these things only for BMS doctor, BMS students in Shillong. So how go for diagnosis? Diagnosis is very important. There should be a suitable examination room with proper light source, and those should be with law for privacy. Suitable patient examination table, it should be comfortable for lithotomy position and other position. Proper size gloves, lubricated anesthetic jelly, sets of proctoscope, that is pediatric, adult, and elderly one. This is with maybe illuminating, self-illuminating. And in our center, we use vaginal speculum commonly for assessment of different internal areas, along with other instrumental equipment. So today, this final year and intern should know, I let's say, how to get tips for diagnosis of digital rectal examination DRE. If not permitted digital rectal examination, even with proper skill and knowledge, it is an acute inflammatory condition like acute T7 or a stricture, inflamed stricture. We should not try for DRE. If DRE permitted, digital rectal examination permitted with normal tone indicate absence of cause of incontinence. Permitted DRE with increased tone indicates structural anomaly. Two digit at the time of DRE indicate the reduction of sphincter tone due to local or systemic cause. So you have to evaluate the different cause of incontinence. Filling of anterior and posterior wall for linear ulceration of different types of each floor base. For assessment of base, we use bidigital examination. This may indicate different stages of fissure in NO. Actually, in book it is written as fissure in NO, but for me it is not a disease. This is symptom of a lots of disease, presentation of a lots of disease. So if a feeling of a soft facing mass at 3-7 11 o'clock position indicate hemorrhage of different stages required evaluation. This may be first degree, this may be second degree hemorrhage, third degree hemorrhage, this may be inflamed hemorrhage, this may be thrombosed, whatever may be, we need evaluation. Healing of a papillae or fibrosis above or below or lateral to the dentate line, above or below the dentate line, or right or left side may indicate the primary site for cryptogenital sepsis, which may be again re-evaluated by the bidigital examination. Again, palpation of prostate is very important because lots of issues in the prostate causes different anorectal symptoms. So even in prostatitis, you will get pain like fissure, even in BPH, there will be presentation of hemorrhoids. So palpation of the prostate anteriorly by digital examination is very important. If it is painful, then it is a good prostatitis. If it is less painful but little bit tenderness is there, then it is chronic prostatitis. If it is severe pain and equivocal, swelling and in different areas there is softness, then this may be a case of prostatic abscess. If it is firm, mucosa free, this may be benign enlargement prostate. If it is nodular fixed, this may be malignant enlargement of prostate. All this can cause hemorrhage. So with digital examination, we have to rule out all these primary causes of hemorrhage. Palpation of rectouterine pulse is also very important. Palpation of any pedunculated mass. If it is pedunculated mass, then we have to evaluate whether it is a benign or malignant one. Initially permitted digital rectal examination, but later on it obstructed, then these are nothing but delayed cases of malignancy. So after this digital examination, if digital examination is possible, then only we should go for this proctoscopic examination. Proper separate consent of patient for proctoscopic evaluation examination is important. Proctoscope size should be in accordance with the age and sex. Proctoscopy to be done only only after digital examination. If you are not expert in digital rectal examination, you should not go for proctoscopy. And to support the findings of the DRE, needed proctoscopy. Proctoscopy always should be done in empty rectum. With a loaded rectum, things cannot be seen. Informed gentle insertion with proper lubrication to the maximum limit is very. And then gradual removal of this with visions. It's important to see the areas. If the field of vision is pink, mucosa is normal. If it is bulky, dotted, with bleeding, we have early cases of proctitis need evaluation. What types of proctitis? Field of vision is occupied by pus, mucus, with evaluation for acute proctocolitis. Field of vision occupied by clotted bud need evaluation for a bleeding source proximal to this. This may be a benign cause, may be a malignant cause. Soft facing mass with or without bleeding need evaluation for different kinds of hemorrhoid. Depression or papillae on the wall needs evaluation for different kinds of fistulas. This may lead to dilatation in the distal part. So, what are the complications of hemorrhoid? There may be profuse hemorrhage. In our center, we get patient even 2 gram hemoglobin, 3 gram hemoglobin patient admitted in our center. In these cases, we'll have to go for blood transfusion. Strangulation due to COVID, this patient deprived from these services in most of the center. Now the patient is coming to our center with different complications, strangulated hemorrhoid, thrombosed hemorrhoid. If there is strangulation, definitely there will be ulceration. If not treated, then there will be gangrene. If we treated somewhere, there will be fibrosis, there will be suppuration, and lots of other issues are there. I will not go in details. So, what is our center protocol for treatment principles of hemorrhoid? So, number one, Nidan Parivarjan, avoidance of the etiological factor. So, number one, Nidan Parivarjan. Number two, Nidan Arthagari Roga Chikitsa. We have already discussed regarding different diseases. So, this is to be treated, then only you can solve the issues of hemorrhoid. Then, Trivit Karma, Vispurva Karma, Pradhan Karma, Paschat Karma for both surgical and parasurgical procedures. Upon biometricity, in my opinion, in hemorrhageal disease, we'll have to correct the upon biometricity and Mondagne, then only the disease that these issues can be solved permanently. So what is Chikitsa Siddhant in our center? Correction of bowel area. First, we should go for non-pharmacological means, counseling, correction of food habit, correction of this posture of defecations, all this non-pharmacological means. Then pharmacological means, some drugs can be used if non-pharmacological regime fail. So first we should go for a non-pharmacological means, then it fails, we go for pharmacological means. Again, even with if this for a few days you use pharmacological drugs, later on this may be shifted to a non-pharmacological means. Then the reduction of defecation time and straining is very important. We usually advise that the defecation time should not be more than 5 minutes. It should be below 5 minutes. 3 minutes is ideal in our part. This reduction of straining, that means when there is an urge of defecation, then only person should go for defecation. Correction of dietary habit. Now due to westernization, we have shifted from our traditional diet to this Western diet. So these are free of this fiber, dietary fiber should be increased, diet should be proportionate. And psychological counseling, most of the patients think that 15 minutes in toilet is normal, 10 minutes in toilet is normal. So patients usually don't know these things. So they suffers from this kind of disease, hemorrhageal disease. So we should go for counseling of the patient that these are the issues. If 20 gram of fecal matter required 30 seconds, then within 2 minutes, maximum your transit time should be 2 minutes. In this way, you can go for counseling of the patient is very important. Correction of Modalities, different drug used to be designed for correction of Modalities. Correction of open bioavarities, different basti preparations already Professor Hammond described. And Roctostoma drug may be required for this. And some oral drug can be used for this treatment. So, 4 types of treatment modalities described: Hashas, Saravarma, Sastravarma, and Agnivarma. We have this protocol. If it is in first degree hemorrhage and second degree hemorrhage, we usually go for Hashasokitsa. If it is second degree hemorrhage, internal, we go for Saravarma. If it is external, we will not go for Saravarma. That's why Sushita nicely described this therapy for advantara. Then, if it is prolapse out or complicated, if it is internal also, if it is complicated, definitely we go for surgical procedure. This is the principles of Sushita's. Then in modern medicine also some medical managements are there, sclerotherapies, there are rubber band ligation, infrared coagulation, ultra rod anal dilatation, and hemorrhagectomy. So, based on this, Nidan Purivarjan, reduction of bowel habit, non-pharmacological avoidance of alcohol. In our center, we usually give different sub-aristas. Commonly, we give awaristas for TSF twice daily if patient is not diabetic. In our center, we usually also give a 1 tablet thrice or also with a rust 2 tablet twice. These different laxatives. In our center, we usually use tricola surnus, Onsosocar surnus, Subsocar surnus, sometimes with tricola and combination of tricola and others. This Arabad and this preparations is available in our center. We usually use. If there is bleeding and all this, this Matravasti already Professor Hammond says about the dose. In our center, we have modified this. We usually ask the patient to take a Kashisabitail 10 minutes before the defecation in the morning and at the bedtime, so that the drug remain in the rectal valve and these areas and this bleeding stop. And the next day there will be an comfortable defecations. And since but it's an every cases of anorectal diseases, we advise the patient for 6 but for 10 minutes. 10 minutes. So Ksharoderma, in our center, we use two types of ksar, that is Polas Pratisharanya ksar and Apomarga Pratisharanya Tikshna ksar. The result of Polas Pratisharanya Tikshna ksar is better than Apomarga Pratisharanya Tikshna ksar. Already Professor Hemant described different the procedures. And Zostimodo Siddha Grit after use of Tikshna ksar, then after application of Tixnaxcar, we use the Nimbusaras, then we use the steam Siddha Grit. And in our center, in each and every case, we give oral drug for ulcers and laxative for another 1 month. Shastrakarma in Siddhas principle is 7 type of Shastrakarma and Shivanas. So in modern medicine, several forms of treatment are now available for internal hemorrhage. Different drugs is available. So number one, fixation sclerotherapy, canolone, almolone, and some other drugs is available. We under local anesthesia with application of a slit proctoscope. This drug injected 2 ml in the submucosa of the hemodilated plexus. So there will be sclerosis, there will be shrinkage, and what is the problem is that after sclerotherapy, sometimes it rebleeding. There will be bleeding after 2 to 3 months, and sometimes it become there will be a persistent swelling inside, which may cause difficulty during defecation. Then another option is rubber band ligation. With a rubber band applicator, there is an applicator. We'll have to catch the hemorrhageal plexus, then we'll have to push the handle behind, and the rubber gets fixed to the plexus. So this is also a very temporary measures. If there is some issues where surgery is not available, cannot be done, or surgery needs some times, then this is very usable. My opinion is that in my life I never depends on rubber band ligation. And cryosurgery is there, lots of new techniques is there. This already Professor Hemant says about laser. What is to be done by laser? With a laser, there will be coagulation of the vessels, and vessels shrink. And with this energy, this heat, there will be the energy to coagulate these vessels, and that the plexus shrink, and it acts like hematoplexis. Infrared coagulation is there again, and these are again the probe is there with this infrared with this coagulate the vessels, and this return become, if nothing gone, this return become easy. Outside also similar thing. Energy used this will coagulate the vessels. Papular dermatomy, all this is a similar thing, different mode of this applications of energies to coagulate the vessels. Then in each and every cases, when we go for anatomy of the hemorrhoid, there is an overactivity of the circular muscles. That's why the return become poor. So if the increased activity of the circular muscle can be negotiated, then it will facilitate the venous return. So in each and every case of our center, we usually go for 4-finger dilatation. That means 4-finger dilatation sometimes may not be possible if patient is operated somewhere, or there is fibrosis and all these things. But possibly always there should be in mind that when you go for dilatation, it should be relaxed. So after a large anal dilatation, there may sometimes for some pack, usually we give capacitive with a covering with a roller bandage. It will create a pressure, it will stop hemorrhage as well as the formation of hematoma. Then in our center, we usually deal with most of the referred cases, and more than 50% of the cases if required, it required operations. After COVID, the scenario changes. Previously, before COVID, 80% cases can be negotiated with medicines or other parasurgical procedure. After COVID, after patient suffers from this cancer disease for 2 years without hospitalization, all these cases become complicated. We get these cases, 90% cases with a horrible hemorrhage, primary, secondary one, large hemorrhage, complicated hemorrhage. Each of the we get 3-4 cases of prolapse hemorrhage with inflamed thrombosed hemorrhage. So the pattern of COVID changes. So in these cases, hemorrhoidectomy is the choice for solution of these issues. So the ligation, one may be an internal ligations, then ligation with excisions may be done, maybe with the use of different diathermies or scissors. Then submucous hemorrhoidectomy is an options. Excision with scissors, already Professor Hammond shows this. Excision of entire piles bearing. So now we are getting very bad cases in our center. There is a name and fame that all these bad cases come to our center. So in these cases, we will have to say we try to save the areas from where the tissue can migrate for healing after surgeries. So this may be in one step, this may be another 2 steps. So depending upon the cases, we will have to design our these surgeries. But then we have to shape the different this sphincters muscles when we get very bad cases. So closed hemorrhoidectomy may be another options. Staple hemorrhoidectomy. In staple hemorrhoidectomy, the basic principle is same. All the 3 plexus will be remaining in between the this staple, these machines, and these are the staple. The church is called staple. But one thing is that in staple hemorrhoidectomy, whatever the cases, in most of the cases there is the formation of a ring-like structure, which easily changes the bowel habit of the patient later on after surgery. So replication may not be easily gained after staple hemorrhoidectomy. So these are the issues, these are new techniques, lots of advantages and disadvantages there. So surgeon should decide which will be beneficial for the patient. Then transhemorrhoidal, so lots of issues. These are case 1. This you can see this application of SARS, this color is, you can see the black color after application of Palas Pratisaranya Ixnoxar. Professor Hemant Kumar already describing these things. So this is again a hemorrhoid. This you can see the hemorrhoid at 3, 7, 11 o'clock position. We go for surgeries. This is again see that this is a bad case again with hemorrhoid with a polyp. You can see a polyp on the hemorrhoidal mass. We will go for excision, ligation of this plexus deep above that and above this line, and we should send it for biopsy. So that's a biopsy is very important for each and every cases of hemorrhoidectomy, because we will have to evaluate whether this is a malignant disease or not. See again, this is a very bad case. You can see the different 2-3 areas and with a polyp outside the hemorrhoid. So usually we go for hemorrhoid. There is nothing this. So this is again a case of very bad cases of hemorrhoid. We usually in single, so you can see in the second photographs regarding dilatations. In the third photograph, you can see how to pull the hemorrhoidal mass, and in the fourth one, how to separate it from the sphincter muscles, how to shape the sphincter muscles, then how to go for surgery. So from above discussion, here you can summarize this. Most of the benign and erectile diseases, including hemorrhoids, are described in Ayurvedic treatise in both tier 3 and lower 3 in terms of etiopathogenesis, clinical presentation, principles of treatment, which are identical with modern era of surgical practice. Different modalities of treatment for ulcers, hemorrhoid described in Sushrit Sonita and are usable and very much beneficial to the patient in terms of affordability and less rate of recurrence. Combined approach of conservative management, and surgical intervention required in different stages of the disease. That means for me, hemorrhoid is not one disease. This is a presentation of different disease. So, which in different stages. So, for different stages, there are different treatment principles described in social center. That's why social describes different types of nurses and different modalities of treatment. So, with medicine, we cannot solve all the issues. Only with surgery, we cannot solve all the issues. Even now, this is COVID, we change our strategy. Again, after hemorrhoidectomy, we give Ayurvedic 2 drugs for 1 month for correction of the different issues related to this. So, hand in hand for proctology, we should help each other. One institute should help another institute, and without help of modern medicine, we cannot go for this evaluations. If we miss the diagnosis, that means the patient's life will be in danger. We cannot allow it. So each and every Ayurvedic doctor should be trained regarding the digital rectal examination, bidigital rectal examination, proctoscopic evaluation, so that they can see the cases and they can give the treatment. I mean to say that all the cases need not require surgery. All the cases need not require parasurgical procedure. And all the cases cannot be treated with, as well as all the cases cannot be cured with Ayurvedic medicines. Different modalities, different choice of drug will be different. Different. If there is more bleeding, we will have to use the other Ayurvedic drug. If there is only drop by droplet, then the drug will be different. If there is some ulceration issues are there, then Ayurvedic drug will be different. If there is a collection of blood, then the issues will be different. If there is a thrombus, then you have to remove it, then the treatment modalities will be different. So, this is a very big topic for us. Hemorrhoid is not a disease, this is a presentation of a group of disease. If we think in this way, we can evaluate it and we can treat the patient. Thank you. Thank you.
Thank you so much, sir, for the information and sharing your slides. Thanks so much. Now we come to the end of the program. I would like to call Dr. Alok Kumar, Assistant Professor of Shailatantra Niya, for the word of thanks.
Hello. Am I audible?
Yes, sir.
Yes, you are audible.
Thank you, ma'am. So I'm here just to give the word of thanks, and I take pride to just say that. First of all, I need to say thank you to our director madam to give us opportunity to organize this workshop. And we also want to thanks to our guest speakers, Professor Hemanta sir and Professor Burman sir, who had just given the consent to deliver the lecture, and the lecture was so informative. I hope our students will learn so many things, and other participants also get benefited with this. Actually, this workshop we plan to organize on the hybrid mode, on the online and as well as offline. We have planned to call Dr. Harman sir to come here offline and just show us few cases, few operative cases in our OT. But unfortunately, there is something happening in Shillong and situation is not well to come to Shillong because there is some disturbance. That's why we just keep it only on online mode. So next time, hopefully, we organize it on a hybrid mode or better on the offline mode. We call both the speakers here and we do some char karma or some procedures and demonstrate some other practitioners, MOs and other PT scholars we call. Hopefully, we do it the next time. And I'm also I want to thank our other participants who have joined. I can see here Dr. Priyanka Patel, Dr. Vinod Gar. Thank you all to join to spare time. And our students, dear students who are just listen our complete both lectures in sitting in their classrooms. And our organizing committee, Dr. Junita sir, Dr. Gaurav Soni, and Mr. Pranti Sharma, who has supported us a lot in this organizing of this webinar. So thank you, one and all.
Thank you, Alok.
Thank you,
madam.
everyone. Priyanka,
Thank you.
nice to see you.
Nice to see you, ma'am. Thank
Yeah.
you.
Yeah. Thank you, everyone.
Thank you. Thank you, sir. Thank you
Yeah.
very much.
And we prepare the certificate and we distribute online through emails. We prepare later. Thank you. Thank you, everyone. Namaste.